I'm doing my project on pertussis, like you said. And pertussis is also known as the whooping cough, which is a highly contagious respiratory disease. This is a little video that shows how it sounds for a child.
Howie, you okay, buddy? Howie.
So, with that being said, the whooping cough is a very highly contagious disease that can be serious in infants, and sometimes it can even be fatal. More than half of the babies under the age of 1 year old who have the whooping cough are hospitalized. And the whooping cough spreads easily from person to person through coughing and sneezing. Unfortunately, some people who spread the whooping cough may not know they have it. Some symptoms of the whooping cough, or once becoming infected with the whooping cough, it takes about 7 to 10 days for the symptoms to appear. At first, the symptoms may come off as a common cold, which are a runny nose, nasal congestion, watery red eyes, a fever, and a cough. Once the symptoms have worsened after two to 3 weeks, they say, a thick mucus builds up inside your airways, causing the uncontrollable coughing, which could lead to vomiting, red or blue face, extreme fatigue, and the whoop sound during the next breath for air. Once the individual has experienced these symptoms, it is time to see a physician. Individuals who do not develop characteristics of the whoop, but develop a persistent hacking cough, which is most common in adults, is also classified as pertussis. Some causes of pertussis are by an infection with the bacterium known as Bordetella pertussis. This bacteria attaches to the lining of the airways in the upper respiratory system and releases toxins that lead to inflammation and swelling. Most doctors believe that individuals acquire the bacteria by breathing in the bacteria that are present in debris released when an infected person coughs or sneezes. This is a picture showing how the pertussis is attaching onto it, and it says pertussis bacteria attacks cells lining in the airways in the body. The rope-like structures shown are cilia, extensions of cells lining these airways. Cilia are housekeepers that sweep away dirt and other inhaled foreign objects that have been caught in the protective mucus produced by the cells. In a whooping cough infection, the pertussis microbes use adhesive proteins to glue onto the lining while releasing toxins that damage the cells, impair cilia, trigger inflammation, and increase mucus production. The body resorts to coughing. So this is what happens. These are the lungs, so the whooping cough happens in the lungs and the bacteria gets stuck up in the lungs. Some risk factors to pertussis or the whooping cough would be really anyone. Anyone is at risk. People who do not have their shots and their immunizations, mostly young infants who are born, who don't have their shots right away, they are particularly vulnerable to the infection, and it causes certain complications such as pneumonia and seizures, which could damage the infant for his or her life further if it is not treated immediately. As mentioned earlier, adults may develop pertussis because their immunity from early childhood vaccinations could have worn off over time. And this is common, and I'll talk about this a little bit later. Some vaccinations. Pertussis vaccine is most commonly given in combination with the vaccines for diphtheria, which is DTaP, and tetanus, which is TDAP. Pertussis is the big P in the DTaP combination, which is routinely given to children, while the lowercase p in TDAP vaccine is given to adolescents and adults, which is also known as the tetanus shot that we all go through once every couple years. Some vaccinations for children The children, they start off with the DTaP. They need 5 of those shots. The first 3 vaccinations are given at 2, 4, and 6 months of age. So right when they come home, and just in case anyone's sick and anyone that they're around, meeting all these new people. The 4th vaccination is given between 15 and 18 months of age. So maybe 1.5. And then the final vaccination, which is the 5th one, is given to the child when they are 4 to 6 years old. Some vaccinations for preteens and adults. 11 or 12 years of age should receive a dose of the TDAP booster, and the same for adults who did not receive the TDAP as a preteen or a teen. This is also known as the tetanus, and the easiest way for adults to ensure immunity is to get the TDAP vaccine instead of their next regular tetanus booster. Now, vaccination for pregnant women. The Pertussis vaccine has been deemed safe for pregnant women. To protect their infants, most pregnant women who were not previously vaccinated with TDAP should receive 1 dose during their late 2nd trimester or 3rd trimester of their pregnancy. The CDC recommends that women get their TDAP vaccine during each pregnancy. So, every pregnancy, maybe this is your 3rd one that you're going to have, and if not administered during the pregnancy, women should get the vaccine postpartum before leaving the hospital or birthing center. When the women receive the TDAP during pregnancy, the antibodies the mother develops to the Bordetella pertussis bacterium and are transferred to the infant, providing some additional protection to the infant before it can be fully vaccinated once the child is born. Pertussis can also be treated with antibiotics if someone already has the shot and they need to get the antibiotics. It is recommended for anyone who has the disease for less than 3 to 4 weeks. These are the 4 antibiotics that they have recommended, and they have been shown to be effective in treating the whooping cough, but they have not cured it. This is a video of a doctor describing the whooping cough.
Whooping cough starts with most kids like a common cold. The baby that gets it will then, after several days to 2 weeks, start coughing so hard that they're throwing up, that they're getting blue around the lips or blue in the whole face, not able to catch their breath. That's when it's getting dangerous. That early sign of when it looks like a cold, it looks like a cold. And so that's the time where, if you know your baby's non-immunized, for whatever reason, there's a way to do a little respiratory nasal swab test in the pediatrician's office to check for whooping cough so they can get the right treatment going if that's what's going on. It's not easy to tell the difference between whooping cough and a common cold in a teenager or an adult. The trick is to keep those folks all immunized. With a baby, the cough will sound different. They'll get a cold for 2 weeks, then they'll get this cough that just means cough, 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 throw up potentially, and then whoo, as they're trying to catch their breath in. Whooping cough is spread by respiratory droplets, just like a common cold. So somebody sneezes, they put their hand on the doorknob's still contagious. Somebody blows their nose and then touches their baby's face, that hand was contagious. The respiratory droplets can be coughed on the baby, and that can be a form of disease spread. Besides good hand washing, the best prevention for whooping cough, which is also called pertussis, is immunization, and immunization on time. Every baby ought to have their immunizations on time. If they do their DPT, that's covering the pertussis or whooping cough part. At age 11, they ought to get the tetanus booster that also contains pertussis. That's called Adacel. And then adults and kids, every 10 years after that, absolutely need a DPT, which is, that covers for the adult version of pertussis tetanus diphtheria. The bad outcomes happen in our youngest family members, our babies. So if a baby gets whooping cough, it can be life-threatening. If your baby has pertussis or whooping cough, see your doctor, keep other kids away and non-immunized people. Make sure all the adults in the house and the older kids are immunized. And also there's antibiotics that can help, so see your doctor.
And that is the end of my presentation. And here are my